I should tell you I grew up in Portland, Oregon, in the suburbs. My father was a private school teacher, and as a result, I went to a fairly good private school and led a very sheltered life. I had read about hunger. I knew about hunger. It was a concept with which I was familiar. And then, as a teenager, I traveled extensively in Latin America, Mexico, Central America, South America. And I saw it. I saw this thing, hunger, on the streets of the cities down there. And I said, oh, that's what that is. That's not a concept. That's a thing that involves people that's a real problem. And then an interesting thing happened when I got back to my comfortable little cocoon in suburban Portland. I saw it there too. And I realized that hunger was a concept that didn't live just in Cusco or Quito or Antofagasta, but in Portland and Beaverton and Olympia and Seattle and Bellevue. My eyes had been opened a little bit, and I recognized that there's a lot of need, a lot of hunger almost everywhere you look. In fits and starts right now, our economy seems to be heating up, moving ahead. But we have seen numbers in the last week that are a little bit startling and prove to us that there's much more work to be done and that there are a lot of people out there who are still struggling just to get by, to make ends meet, and to find a meal when they want. At the beginning of summer of 2007, the unemployment rate in King County was a little under 4%. 4 years later, it's 8.7%. And of course, a lot of people out there are what we call underemployed or have given up looking and are simply no longer part of the statistics. They just don't get counted. So the real unemployment figures in our area probably pushing 15, 16%. Those are big numbers. Those are the kind of numbers that cause a lot more people to reach out for help. People who might not be used to doing that, people who might not have had to do it in the past. They're facing hardships. They need help. That means that local food banks have been under a lot more pressure. And since 2007, we've seen an increase in the number of people looking for help at local food banks, an increase of 26%. That's 43,000 more people each month who need someone else to help them put food on the table. I did a story a couple of weeks ago, maybe a month ago, down in Covington. This is a middle school where they had set up, the teachers and the students and the staff had set up a food bank right there in the school, just because the need in their community was so great. They set it up in the back, in a back room of the school, near a door to a back parking lot, so that parents at that school could come and pick up the food and do it quietly without being seen by a lot of people. Often parents of the same kids who had worked on the food drive to fill the food bank with food. This is a school where 40% of the students get a free lunch or on some kind of subsidized food program because there just isn't enough food on the table at home. The students that I talked to were tremendous, great kids, really gave hope for the future. They said, of course, we were just looking for an opportunity, a way of giving, because they looked around at their community and saw that there was a need. And they told me, it's fantastic to have the opportunity to give this way, to help our classmates, to help families in the neighborhood. One student, in fact, told me that A, he was going to be a doctor soon, and I believe him, a 16-year-old, and B, he wished there was a lot more of that kind of commitment in the community. He said there's just such a big need here. We need more of this. In fact, if we look around the world, we need more of it in a lot more places. That was nice to hear from a teenager. We're going to get some more insight into the issue of hunger, the general issue of hunger, how it affects people in our community and around the world today. Please join me in welcoming Dr. Adam Drewnowski.
Thank you.
Enjoy.
Thanks so much. I'm a researcher in public health nutrition, and I always get the same question from people. What should I eat? and I'm asked, should I choose a diet that's low carb or high carb? Should I choose a diet that's low in fat and high in protein? How do I choose between different kinds of government advice? My pyramid or my plate? And my answer is the same. You are lucky to have a choice. For many segments of our society, for many of the families living right here in Seattle, choices are very limited by their economic circumstances. So the question is not just how to put food on a table, the question is how to put the right kind of food on a table. The pushback I get is people saying, why doesn't a low-income family just buy a bunch of lentils and live on them for a week? And I say, well, that is not the way to behave. They are people too. They want to have access to foods which are nutrient-rich, affordable, sustainable, and appealing. How do we put the right food on the right tables? And that is where public health nutrition takes over from personal nutrition, because we want to deal with the health of the community, the health of the county, the health of the region, and ultimately, even the health of the planet. So my personal research has been on the obesity epidemic. And there are things I want to tell you about the obesity epidemic in Seattle King County and everywhere else. We sometimes think it's genetic. We sometimes think it is metabolic. We think a drug will come along and take care of everything. And I say absolutely not. The obesity epidemic is actually a social and economic phenomenon. It is a body's response to harsh economic conditions. And as you will see later on, it's actually perfectly possible for hunger and obesity to coexist. Just because people have enough cheap, empty calories, they are not well nourished. They are, in fact, hungry for nutrients, and we need to do something about that. Another point, the obesity epidemic has a home. Our research deals with local issues. Our research deals with neighborhoods in Seattle King County. Our research deals with local conditions. So I can tell you later on that we know exactly where the fat neighborhoods are and where the lean neighborhoods are. In fact, life expectancy even depends on where you live. So with those thoughts, let me tell you about the economics of food choice. An average person needs about 2,000 calories per day. The breakfast you have in front of you is probably about 600, about 1/3 of your daily consumption. Now, those calories come at a cost. So, for example, you can get 1,200 calories from candy at Halloween. You can get 400 to 500 calories from donuts. You get several hundred calories from a sweetened soft drink, but you only get about 40 or 50 or 60 calories from apples or carrots or blueberries or other fresh fruit. So there is going to be a cost to the quality of your diet. And the cheap, empty calories are, in fact, nutrient poor. So there actually is a paradox. The paradox was emphasized by Michael Pollan, who was quoting some of my research. He was saying, pay more to eat less. And the problem is that many of the Seattle families are paying less to eat more. If you buy cheap foods because you have no other choice, it is easy to overeat. In fact, as incomes go down, as unemployment comes up or underemployment, the first thing people want to do is to have the same number of calories per day, because nobody wants their children or themselves to go hungry. So that means the food choices are going to go in the direction of cheaper calories, more calories for your dollar, and then fewer nutrients for your dollar. So with the shrinking food dollar, purchases go towards energy-dense foods. But the question is it really a choice, or is it a choice driven by social and economic circumstances? It's not that people went to a store and say, I will buy Twinkies for my children instead of nutrient-rich foods. This is not a choice. This is not a voluntary choice. And we need to make sure that there is access to healthy foods for everyone in Seattle King County. So that hunger and obesity can in fact coexist, and people who go to food banks, it has been said, are sometimes overweight. Yes, they are. Obesity is actually the new face of hunger in America, and the struggle against obesity and the battle against hunger are, in my perception, one and the same. The point, of course, is that obesity, hunger, deprivation, diabetes, chronic disease hit the same exact neighborhoods, and I can tell you what they are. So the link between poverty and obesity is actually the high cost of nutrient-rich foods, and the current spike in food prices, both locally and worldwide, isn't helping. The high cost of gas is not helping. Many families are struggling, as I said, to put food on the table and to put the right kind of food on the table. So let me now tell you about obesity by neighborhood in Seattle. Some people say, there is no obesity epidemic. I never see any obese people near where I live. Well, that depends exactly on where you live. Our data are showing that there is, in fact, an obesity gradient that goes from north to south. You can call I-5 the obesity corridor. In fact, every few miles down south on I-5, obesity rates will go up by several percent. We now have data by zip codes. We have data by census tracts. We have individual level data from studies funded by the federal government, and I can tell you that even within Seattle King County, we're seeing six-fold disparities in obesity rates. And yet King County is supposed to be the healthiest, or one of the healthiest counties in Washington state. Not exactly. There are going to be pockets of deprivation. There are going to be areas of poverty. There are going to be food deserts, and our research can tell you where they are. In fact, we're using data from various county sources, including data from the county tax assessor, and I can tell you that obesity rates vary as a function of property values and real estate prices. So for every $100,000 in higher property values, obesity rates again drop by a few percent. So the whole thing is totally tied to socioeconomic factors. It is tied to wealth and assets or lack of them. It is tied to poverty, deprivation, lack of access to resources, and lack of access to services. So is it in fact acceptable that the zip code or the census tract or the address should determine your body weight, your health, your likelihood of diabetes, your risk for cardiovascular disease, and even your life expectancy? Again, going down on I-5 and going down towards South County, life expectancy rates decrease, obesity rates go up, and the whole thing is really linked to social and economic circumstances of people today. And people say, well, we can't do much about those. Yes, we can. I think we can do something about this, and we need to make sure that those social disparities are minimized or eliminated altogether. Now, how do we do that? There are practical solutions. There are things that we can do right here and right now. We can certainly look at how to make sure that people have access to food assistance, that they have access to food stamps, they get access to services. But there's really more that needs to be done, because there are foods which are affordable, nutrient-rich, sustainable, and good tasting. You can have them. They exist in every supermarket. They are the eggs, beans, fresh produce, bananas, carrots. Those foods give you nutrients, and they also give you maximum nutrients per dollar. But there is one thing. You have to be able to cook those foods. And for many families, cooking skills are a thing of the past. Children do not learn them, either in school or in college. So I want to finish with a message: bring back home economics. Teach cooking skills, teach economics, teach food costs, and bring it back so that families can enjoy healthy, nutritious dinners together. Thank you.